I'm Kelly Warner. We are 18 months into the pandemic, and with all the changes we've experienced, there's still a lot of confusion when it comes to COVID 19. Specifically, when should you be tested for the virus? And when should you isolate versus quarantine?
Pediatrician Dr. Pilar Bradshaw says she's not surprised that people still have questions about COVID 19.
The COVID pandemic is challenging for everyone in a million ways. One of the things that's challenging is keeping up to date on the latest recommendations regarding testing as well as isolation and quarantine.
When should you be tested for COVID 19? If you're sick with symptoms of COVID, get tested immediately. If you've been in close contact with someone positively diagnosed with COVID, that means you were within 6 feet of the infected person for 15 minutes or more in a 24-hour period, and you have no symptoms and you are unvaccinated, get tested. If you were a close contact, have no symptoms, but are vaccinated, you should be tested 3 to 5 days following that possible exposure. Another point of confusion is when to quarantine and when to isolate. If you are a close contact with someone with COVID 19, you're advised to quarantine, which means to stay home, away from people outside of those you live with, and you should do that for 14 days.
Don't be getting a contact trace test and then go off and do 15 errands, because in that process, you will have exposed potentially a lot of people to COVID.
If you test positive for COVID 19, regardless of whether you have symptoms or not, you must isolate, which means staying away from other people, including people who live with you. You may have to isolate for up to 10 days.
And you can't come out of isolation until all of your symptoms are resolved except the loss of smell or taste. For sure, your fever and cough and congestion needs to be resolved before you come out of isolation.
Another point of confusion is which kind of COVID test is best. Learn more about that and the symptoms of COVID 19 at eugenepeds.com/healthykids. I'm Kelly Warner.